information. So without further ado, I'm going to turn it over to Secretary Rita Langraf.
Thank you so much, Lolita. Thank you for hosting us today relative to our marketplace kickoff event to actually inform everyone. Thank you for the media for being here, because we do want people to recognize that we are in that final week for enrollment. And enrollment will go to January the 31st. So indeed, critically important that everyone is aware of that deadline. Thank you, Lolita, for being such a tremendous partner and for being the leader here at Westside. You know, we benefited greatly from your engagement, not only relative to the marketplace, but also the wonderful work that goes on as a federally qualified healthcare center, and also as a leader relative to all the health innovation work that is occurring in our state. We know that Senator Carper will also be joining us momentarily. And you know, the senator, we just want to thank him for his unwavering support relative to the Affordable Care Act and the rollout of the implementation of Delaware's marketplace. And also, you know, the senator, when he was governor, was very committed relative to ensuring that people had access to health care and was actually expanded our Medicaid program back in 1996. And we have indeed, again, because of the Affordable Care Act, expanded it even further. So for those who are in poverty, get greater access relative to our Medicaid program. And I'd also like to thank Commissioner Stewart for also being such a strong partner, and for her team at the Department of Insurance. Indeed, Delaware, you know, as stakeholders, everybody comes to the table to look at how can we provide access to health insurance as a state, and we all partnered, and I just appreciate that great partnership with the Department of Insurance. I also would like to recognize our other enrollment partners, the federal navigators from Chapman, our other federally qualified healthcare centers, Lorette Health Center and Henrietta Johnson Medical Center, and of course our certified insurance agents and brokers who are also always there to assist Delawareans. Now, you all play a most critical role in connecting Delawareans to care. And for those who need in-person, knowledgeable, and free assistance in enrolling, I want to thank all those who support those looking for health insurance in assisting them in gaining that health insurance. You know, sometimes gaining health insurance can be a rather complicated process. And I know Caitlin's going to talk about that as one of our presenters here today. And so we are very, very grateful that people are available to walk people through this process and actually show them what insurance plans may best meet their needs. As Lolita emphasized, go to choosehealthde.com to find contact information or to make an appointment these remaining 6 days. I know all of our sisters will indeed be busy between now and Sunday, January the 31st, for that final deadline. Next, I'd like to recognize our federal congressional delegation for their support of the Affordable Care Act, and I know we have representatives here. From Senator Carper's office, Laura Whistler.
Senator will be here shortly.
The Senator will be here shortly, but Laura, thank you for being here as well. And originally, I know Kate Rohr is here. Hi, Kate. Thank you for joining us. I know Senator Coons would have been here, but probably is on a travel delay due to the wonderful weather that we've all been experiencing over the weekend. But thank you, Kate, for joining us this morning. And Drew Slater is here representing Congressman Carney's office. Thank you as well, Drew, for being here. Now, we're here today, of course, to remind Delawareans that they only have until Sunday to sign up for health insurance coverage through the marketplace. We're very grateful to have made it throughout this weekend storm, and thank you, media, for joining us today. And now it's time to indeed shift our focus to January 31st. I know many probably needed to access actually health care services over this past weekend. You know, maybe from a hurt back from doing that shoveling, maybe not using your legs and using your back and lifting rather than pushing. So indeed, we are very grateful for our health systems to be here to support our citizens every day of the week. Now this Sunday, as we know it, is a firm deadline, and no one should expect any extra time to actually sign up. We really want citizens to come in this week and not take for granted that maybe there would be an extension. We are fortunate that our delegation and my boss, Governor Jack Markell, all understand that at the core of the health insurance market is really about connecting people, individuals and families, to coverage, which also connects them to care. In a few minutes, you will hear from Caitlin, an individual who now has coverage through our marketplace, as well as a navigator who will talk about Ricardo's experiencing in accessing our marketplace and why it was so critically important for this level of access. We appreciate you sharing your personal story. I have said all along that if all we do is assist people gain access to health insurance coverage, we actually have failed. The real success does lie in connecting people to that quality health care, to improving the quality of life for all our citizens in Delaware. Already, our enrollment season, more than 26,000 Delawareans have signed up for coverage or renewed their plans on the marketplace. And more than 80% of those who have enrolled have indeed been eligible for the tax credits to reduce those monthly premiums. That's one thing that most people who are new to the marketplace didn't really know about, that tax credits are indeed available for individuals making up to $46,000 a year, and for families making up to $95,000 a year. In fact, that tax credit averages about $260 a month in Delaware. Our in-person assisters can assist people in figuring out which of the private plans that is best for them and their family, so that the families and individuals can indeed maximize any tax credit or those cost-sharing plans that are available to you. In these final days, we also want to continue our outreach to those populations and to those communities that we didn't reach last year. As you see today, we are doing this event in Dover, which is one of the 6 areas of the state where enrollment rates have been lower, and where we think that there is a particular opportunity to reach people who are uninsured or underinsured through additional marketing and outreach efforts. The other areas in our state are the greater Newcastle, Smyrna, Georgetown, Seaford, and south and west of Wilmington. We also know that there's an opportunity for improved enrollment rates with our Hispanic and Latino population. In a few minutes, you will hear from a navigator who actually supported people in embracing coverage through the marketplace for very important reasons. And thank you to the navigators who are building and earning that trust for that population. We have worked hard to earn that trust through a culturally competent marketing campaign, through bilingual marketplace navigators, and through experiences and practice. Across our healthcare system, whether it's through our agents or brokers in a hospital or a federally qualified health center, or sitting with a bilingual marketplace navigator, we will convey this simple idea. Health insurance is the way to protect yourself and your family. As the Secretary of Health and as a member of the Healthcare Commission, I have heard and still hear the criticisms and the worries that the premiums are not affordable and that these deductibles remain too high. Those concerns come despite the fine work of our Commissioner, Commissioner Stewart, and all the individuals at the Department of Insurance to make sure that the rates accurately reflect the cost that insurers have incurred. I can assure you that across our state, we continue to work to bring down that cost of health care, while also improving the outcomes as well as the experiences for our consumers and for our providers. That is the work of the Delaware Center for Health Innovation, and I know that it will have a positive impact on all Delawareans as we change the way healthcare is delivered and paid for in our state. In these final days of open enrollment on the marketplace, I encourage all Delawareans who are uninsured or underinsured, again, to go first to choosehealthde.com for information, and then to go to healthcare.gov to do that enrollment sign up. On healthcare.gov, you will find a feature associated with all of Delaware's 29 plans to help better understand not only the premiums, but also the out-of-pocket expenses like the co-pays and the cost sharing. It is a true picture of what you and your family will spend on health insurance, and then again on accessing quality health care. Now, for those who will take a chance and go without health insurance, or just choose to pay for medical expenses as they occur, I do feel responsibility to remind everyone that in addition to those health expenses, federal law requires those who are eligible for health insurance to have it, or they will pay a fine. And for the year 2016, that penalty is $695 for each adult in a household and $347.50 for each child in a household, or 2.5% of your household income, whichever is higher. Now, during these last few days, I encourage everyone who needs that health insurance to go to choosehealthde.com and to healthcare.gov, or to contact one of our fabulous marketplace navigators, assisters, or certified insurance agents or brokers to explore your options. Your peace of mind is worth it. Now it is my pleasure